I don't want to put words in Anthony's mouth, by the way, and I like him. Today I walk in, I hear I'm going to fire him. I'm not firing him. I think he's a wonderful guy.
Dr. Anthony Fauci,
Thank you very much, Mr. President.
the most trusted member of President Trump's coronavirus task force, a veteran of multiple health crises for 6 administrations, now embroiled in a political drama. The hashtag #FireFauci, retweeted by the president's Twitter account over the weekend, fueling speculation about his trust in the doctor.
Tweet something that said fire Fauci. Why did you
fire Fauci?
I retweeted somebody. I don't know. They said fire. Doesn't matter.
President Trump trying to squash rumors and conspiracies.
Oh, I like him. I think he's terrific.
Well, I'm cautiously optimistic about it.
For more than 30 years, Fauci has been the voice America looks to for a simple explanation of the scientific facts, unafraid to deliver a reality check to both officials and Americans.
I've served 6 presidents, and I have never done anything other than tell the exact scientific evidence and made policy recommendations based on the science and the evidence.
Now he's the most visible medical expert in the latest crisis, appearing on hundreds of TV and radio interviews. His stature as an expert in infectious diseases began in 1984 as a new and mysterious infection, HIV, appeared in the AIDS epidemic ballooned.
Clearly, the way to disseminate the scientific information that becomes available is to do it through the scientific channel.
At the time, the young scientist leaning on facts to reject ill-informed misconceptions that had only affected gay men.
This can be transmitted, this virus, by heterosexual contact from women to men as well as from men to women.
Advising President Reagan on the deadly virus, who for years refused to acknowledge the disease even as thousands died across the country.
The way Tony Fauci stepped forward as a 30-something scientist at NIH and said, guys, this isn't immoral. This is a disease. Let's treat it that way. And the compassion and courage that it took at that time to step forward and say, we have to address this public health issue of HIV/AIDS, you know, it was heroic.
Fauci's assistant at the time, Dr. Margaret Hamburg.
He made us rethink how we do rigorous scientific research, that we can do it in ways that are responsive to the needs and concerns of patients and the urgency of the situation.
Dr. Nelson Michael also met Fauci around the same time.
Great leaders are humble yet bold.
That is definitely him.
He says Fauci brings his compassionate bedside manner to the way he briefs the country.
He and I both grew up in the era of taking care of patients where our diagnostics weren't that good. We watched patients die, patients that we really had become quite bonded to. So we've lived through some tough times. I've equated that to he and I being like combat veterans.
His work later recognized with the Presidential Medal of Freedom. In the midst of the bird flu outbreak in 2006, Fauci joined a choir of scientists concerned that a global pandemic was on the horizon.
Is there anything ordinary Americans should be doing right now as they watch this?
No, I think ordinary Americans should be doing exactly what they're doing, observing, paying attention to what's going on.
ABC's Terry Moran spoke with Fauci, who was already fearing a virus could mutate into something that could be transmitted through close contact.
He was saying at that time, at some point, we're going to get the big one. We're going to get a virus loose in the world that cannot be contained, and he was urging president after president to prepare for it.
Then when Ebola struck in 2016, Fauci wasn't just a voice at the podium.
Thank you very much to the doctors and nurses.
But also donned his white coat, treating patients stricken with the virus, like nurse Nina Pham.
I'll never forget those images. He's in his white coat, and he has his arm around her. He's saying, she is no longer a threat to you or the community. She is a human being. She can't give you Ebola infection.
Even when COVID-19 was barely registering with the public, Dr. Fauci had been sounding the alarm for weeks.
The issue now with this is that there's a lot of unknowns.
Then thrust into a higher profile role as a member of the White House task force.
America's top expert on that subject.
The nation's top doctor on infectious diseases, Dr. Anthony Fauci.
His relationship with the president has been put under a microscope.
There's become this little cottage industry on the right that portrays Dr. Fauci as this anti-Trump figure, as somebody who's trying to bring down the administration. It's really strange but it has some serious consequences. There have been threats on Dr. Fauci, and they've actually had to provide security for him, something very unusual for a doctor toiling away at NIH.
Scrutinized even more after an interview with CNN Sunday, in which he was asked to speculate on measures that could have been taken earlier.
You could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. But there was a lot of pushback about shutting things down back then.
Then the president retweeted that message with the hashtag #FireFauci. Yesterday, Fauci appeared to backtrack his comments from the interview.
The first and only time that Dr. Birx and I went in and formally made a recommendation to the president to actually have a, quote, shutdown. The president listened to the recommendation.
With one poll showing 78% of participants approve of his performance, compared to the 46% who approve of the president.
He has a remarkable ability to take a complex subject and then to make it understandable to anybody who's listening. And he does it with grace, and he does it with dignity.
This is a moment when we need him, we need his vision, we need his energy, we need his commitment. And certainly those of us who've had the opportunity to work with him are grateful.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.
Well, good evening once again. Day 1181 of the Trump administration, 203 days remaining until our next presidential election. And the takeaway from today's White House coronavirus briefing was this. Putting aside the death toll, where Donald Trump is concerned, things are looking pretty good out there. All of his statements today adhered to his hard and fast rules of phraseology. When feeling victimized, he says nobody thought it was possible. Virtually anything he's promising in the future is in a very short period of time. And when he wants credit for something, it's something the likes of which nobody's ever seen. There was a lot of that today, and along the way, he pretty much blamed the World Health Organization for what's happened to us after, of course, praising their work early on in this crisis before it became his crisis. Today was mostly about this grand reopening he's planning. He says it's going to happen in some places very, very shortly. And he did that one better, promising it almost immediately. He says he's going to authorize each governor to open their individual states. Of course, that's not a thing. They're already governors. The president said our country is like a puzzle made up of beautiful pieces. He said today, we'll open it up in beautiful little pieces. About knowing who is sick and who is well before everyone streams back into work, he said the individual governors have testing and companies can do testing. He said it will be a very beautiful process. When a reporter quoted Dr. Fauci as saying we didn't have enough testing yet, the president shot back, I don't know what he said. Nobody knows. On Democratic governors, he said, I think they like me. Outside the Rose Garden in the real world, the death toll in our country today is nearing 30,000 souls. We've not yet tested a full 1% of our citizens. We already know of more than 600,000 confirmed cases. Meanwhile, New York City today revised its death toll to include an additional 3,700 people presumed to have died from the virus, which means the city alone has now passed 10,000 deaths. And New York State now has more than 200,000 cases, about a third of the entire U.S., as the number of worldwide infections approaches 2 million. And as the International Monetary Fund is warning us, the global economy will this year likely suffer the worst crisis since the Great Depression of the 1930s. The president decided this was as good a time as any to punish, to threaten the World Health Organization for its handling of the virus.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. The WHO's attack on travel restrictions put political correctness above life-saving measures and defended the actions of the Chinese government, even praising China for its so-called transparency. It would have been so easy to be truthful. And so much death has been caused by their mistakes.
This was the same president who posted this back in February, and we quote, "The coronavirus is very much under control in the USA. We are in contact with everyone and all relevant countries. CDC and World Health have been working hard and very smart." In recent weeks, Trump has hinted he's eager to reopen at least parts of our country as soon as he possibly can, despite the risks that are obvious to us all. Tonight, the Washington Post reports one team of government officials, it's being led by FEMA and the Centers for Disease Control, has come up with a public health strategy that's part of a larger White House plan to get people back to work. The document, quote, has been discussed at the White House, including by members of the coronavirus task force. President Trump wants a final plan on reopening the country ready within days so he can issue suggestions for some states to reopen May 1. Several of the nation's governors have said they plan to lift their states' restrictions when they feel it's safe to do so. That's the job of a governor. Trump has incorrectly insisted that he had, quote, total authority to order those restrictions lifted. Today, he laid out his strategy for reopening our country.
I will be speaking to all 50 governors very shortly, and I will then be authorizing each individual governor of each individual state to implement a reopening and a very powerful reopening plan of their state at a time and in a manner as most appropriate.
What if they don't listen to you or take your advice or obey you? Will you consider taking away their federal funding?
I don't want to say that. They'll listen. They'll be fine. I think we're going to have a good relationship. They need the federal government, not only for funding, and I'm not saying take it away, but they need it for advice. They'll need maybe equipment that we have.
In a new interview with the Associated Press, Dr. Anthony Fauci made it clear that we are, quote, not there yet when it comes to potentially reopening the country on the president's timeline. Tonight on this network, Fauci was asked what needs to be in place before stay-at-home rules are relaxed.
You've got to be able to identify, isolate, get out of circulation, and do adequate and appropriate contact tracing as new cases arise. If you start pulling back on mitigation, physical separations, there will be infections. The real proof of the pudding of the success of this reentry is how quickly and effectively you identify them, you get them out of circulation, you give them care where needed, and you do contact tracing so that you don't have a beginning of a peak.
Now, as for coronavirus testing, we still have no way to reliably answer the basic question of who has the virus and who might have immunity. Tonight, Politico reporting the number of coronavirus tests analyzed each day by commercial labs in our country plummeted by more than 30% over the past week, even though new infections are still rising in a lot of places. At the White House, Trump appeared to signal that the issue would not be an obstacle to his goal of getting the economy up and running.
Individual states, when the governors will be held accountable, if they need things, we'll help them get those things, but we want them to do their testing. We want them because they're equipped to do testing. We've created incredible tests, and we've done more testing than anybody's ever done in the world.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.